Now let's talk about differential diagnosis and treatment in TCM. Key points here, we will have to discuss what a syndrome is. Syndrome is a pathological summary during a stage of disease onset. It includes etiology, location of disease, pathology, as well as relationship between right and evil pathogen. Differential diagnosis refers to analysis, differentiation, recognition, and summarizing of the syndrome of a disease by the collection of medical history, symptoms, and signs through the four traditional methods of inspection, olfaction, inquiry, and palpation. Treatment determination refers to the choice and formulation of the corresponding therapeutic principle as well as the method according to the result of the differential diagnosis. Same disease but different treatment. This method refers to the different treatment principles due to different disease onsets, different disease locations, different body reactions, or different stages of the disease originating from the same kind of a disease. In other words, treatments are based on the different syndromes. Different diseases but same treatment. This method refers to the same treatment principle based on diseases with similar etiology and pathology. There are fundamental differences among the syndromes, symptoms, and diseases. Symptoms refer to the complaints by a patient, such as headache and abdominal pain. The same symptom may have different reasons, and its pathological mechanism can also be completely different. Disease refers to a complete morbid process, including specific etiology, disease onset, typical clinical presentation, prognosis, and outcome. For example, common cold, stroke, and dysentery are all diseases. Therefore, compared to symptom and disease, syndrome reflects much profound pathological change than the disease itself and symptom. Differential diagnosis refers to analysis, differentiation, recognition, and summarizing of the syndrome of a disease by the collection of medical history, symptoms, and signs through the four traditional methods of inspection, olfaction, inquiry, and palpation. Treatment determination refers to choice and formulation of corresponding therapeutic principle, as well as the method according to the results of the differential diagnosis. Differential diagnosis is the prerequisite and basis for treatment determination, whereas treatment determination is the means and method for treating disease based on the result of differential diagnosis as well as its execution. Treatment result can test the precision of differential diagnosis and treatment determination. During clinical treatment, two different therapeutic methods, different treatments for the same disease and the same treatment for different diseases can be applied separately according to the results of differential diagnosis. Same disease but different treatment refers to different treatment principles employed due to different disease onsets, different disease locations, different body reactions, or different stages of the disease originating from the same kind of a disease. In other words, different treatments are based on different syndromes. Different diseases but same treatment refers to use of the same treatment principle based on the different diseases with similar etiology and pathology. In other words, the syndromes are the same. On the whole, TCM treatment is based on the syndrome instead of different diseases because the same syndrome represents the same pathomechanism. The same or similar treatment can be given, and different syndromes represent different pathomechanisms. Therefore, the treatment must be given differently. This reflects the true essence of differential diagnosis and treatment. Yin-yang and the five elements belong to ancient Chinese philosophy. It is the methodology by which our ancestors recognized and explained nature. The five elements permeate TCM and become an inseparable part of TCM. The yin-yang and five elements theory is applied in TCM and has become the theoretical tool and methodology of TCM. It determines the thinking mode of TCM and directs its clinical practice. Thank you for your attention.
Let's discuss interviewing, the constipation and diarrhea. Here we have illustration of pathogenesis of constipation. From the top, there is food stagnation and phlegm accumulation, which results to obstruction affecting the large intestine. On the right side, we have the Qi or Yang deficiency or Qi stagnation, which has lack of force affecting the large intestine. On the right side, we have the Yin or blood deficiency and heat, which cause lack of moisture affecting the large intestine, which result or compromises the transportation function, which results to constipation. For the symptoms, we have a severe constipation, dry stools, abdominal pain, distension, dry mouth, red tongue, rapid pulse, which is a form of excess, which indicates excess heat in the stomach and intestine, with a pathogenesis of excess heat in the stomach and intestine, which induces fluid and cause dry stool. For the symptoms of constipation with small stools, such as might be left by a goat, stools are not dry, may alternate with diarrhea, symptoms induced or aggravated by emotional stress or lack of physical activity, which is also an excess condition, which indicates liver Qi stagnation or liver attacking the spleen. For the pathogenesis, liver and spleen Qi stagnation will cause intestinal Qi to stagnate. Large intestine loses its transportation function. For the symptoms with dry stool or soft stool with days between bowel movement, has desire to defecate but lacks energy to complete movement. Extremely tired after bowel movement may include rectal prolapse. This indicates a deficiency condition on the spleen and lung Qi deficiency. For the pathogenesis, spleen and lung Qi deficiency will cause the large intestine to lose force in its transportation. Symptoms more common among the elderly or postpartum women with round dry stools, normal frequency, however, difficult passing of stools, dizziness, pale complexion. It is a deficiency condition, the blood and yin deficiency with the pathogenesis of blood or yin deficiency, which fails to moisturize the intestinal tract. For the difficult defecation with stool may or may not be dry. There is abdominal pain relieved by warmth, cold limbs, weak or cold knees, pale tongue, deep and slow pulse. It is indicated by spleen and kidney yang deficiency. The pathogenesis is the yang Qi deficiency causes weakness to the large intestine's transportation function. Next is the diarrhea or loose stools. For the definition, it is a frequent passing of watery or shapeless feces. For the etiology and pathomechanism of loose stool, the pathomechanism of diarrhea is usually too much fluid or dampness accumulating in the intestine with increased intestinal peristalsis. The main pathological change which cause diarrhea occur in the spleen and stomach, where dampness originates as a pathogenic factor. Dampness can arise from either the exterior, such as an attack of damp heat or damp food, improper diet, or some organ dysfunction. Interior dampness arises from a dysfunction of the spleen. It is either due to liver attacking or to deficiency of the spleen and or kidney. If the spleen functions or transportation fail, dampness will accumulate. So we have here the pathogenesis of diarrhea. From the left, if there is an improper diet or exopathogenic dampness, this is an external dampness. On the right, if there is liver Qi stagnation, spleen yang deficiency, kidney yang deficiency, this results to internal dampness, which there is accumulation in the large intestine and result to diarrhea. For the symptoms of acute onset foul-smelling stool with blood or mucus, burning sensation in the anus, tenesmus. There is a damp heat in the lower burner. For the diarrhea with watery stool, abdominal pain relieved by warm borborygmus, tenesmus, this indicates cold damp invasion. For the diarrhea after overeating with smelly stools with undigested food and copious foul-smelling gas, this indicates food stagnation. If there's a diarrhea with tenesmus induced or aggravated by emotional stress, alternating with constipation, this indicates liver fire attacking the spleen. If there's dark green watery diarrhea with foul smell, severe abdominal pain that resists pressure, pain is not relieved following passage of diarrhea. This indicates a Yang Ming Fu pattern. All of this is an excess type diarrhea, an acute onset, short duration with frequent diarrhea. For the symptoms with chronic diarrhea or loose stools that contain undigested food, diarrhea worse after eating greasy or cold raw food. This indicates a spleen deficiency. If there is early morning diarrhea with undigested food, diarrhea immediately follows intestinal borborygmus and abdominal pain, which is relieved after passing diarrhea. This indicates a kidney deficiency. So this is a deficiency type. Chronic duration conditions appears intermittently. Thank you for your attention.
Let's continue with diagnosis according to pathogenic Qi with the pattern dampness and damp heat. A distinction is made in Chinese medicine between internally generated dampness and exogenous dampness, despite the fact that many of the symptoms are very similar. Exogenous dampness is the result of climatic influences, such as living or working in a damp environment. Internally generated dampness can arise when there is a deficient condition in the spleen or when there has been an excessive consumption of food and beverages that produce dampness in the body. If the spleen does not transform the food and beverages consumed as it should, it will not separate the pure from the impure. The impure qi in the form of dampness will be extracted from food and liquid that has been consumed, while pure qi will be sent down to the intestines and out of the body. Dampness will accumulate and initially disrupt the qi mechanism in the middle jaw, especially the functioning of the spleen. Dampness, which is yin, will tend to seep downwards and accumulate in the lower jaw. Exogenous dampness often invades the body through the yin channels in the legs and can be drawn up into, again accumulating in the lower jaw. The symptoms and signs of dampness are varied and will depend on whereabouts in the body the dampness is located and which organs are affected. Dampness is extremely yin. It's heavy and sticky and creates stagnation. Dampness will block the movements of qi and burden yang. The spleen loads dampness, which will rapidly block its qi mechanism. The accumulation of qi in the middle jaw will result in nausea and a loss of appetite. Fatigue arises because the production of qi in the middle jaw is disrupted and because qi is hindered in its movement by the dampness. This will often result in a sensation of heaviness in the arms and legs. Because the spleen is disturbed in its transformation of the food, and because the body attempts to get rid of the accumulated dampness, there is often loose stools or diarrhea when there is dampness. Dampness will seep down to the lower jaw due to its yin nature. This can be seen in, amongst other things, increased vaginal discharge and cloudy urine. Dampness could also block the Qi mechanism in the urinary bladder, and this will result in difficult or blocked urination. If dampness is transformed into damp heat, the secretions and exudations from the body become sticky, yellowish, and odorous. If dampness is transported up to the head, it can block the shen and the heart's orifices in the head. This will manifest with fuzzy and heavy sensation in the head, as if the brain is wrapped in cotton wool. Some skin disorders can have an aspect of dampness. There are vesicles, weeping skin, or itching skin. This can be a sign that there is dampness. Damp heat will make the vesicles and the exudation from the skin yellow, and the skin itself may be red. If dampness invades the channel system, the joints will be swollen and the pain will be dull or heavy. Dampness blocks the movement of qi. This can make joints feel numb. The pain will be localized to a single joint and it will not migrate from joint to joint. As stated, distinction is made between exogenous dampness and internally generated dampness. But within each of these two categories, there are several subcategories depending on where the dampness is located. Thank you for your attention.
We proceed with diagnosis according to 6 stages. This time we discuss invasion of wind cold in the Taiyang aspect. In this pattern, pathogenic qi has been so virulent that it has been strong enough to penetrate the body's wei qi. Zheng qi is relatively strong. This means that the symptoms and signs will be more pronounced than in the pattern invasion of wind cold in the Taiyang aspect when it's dominant. The symptoms are characterized by pathogenic qi inhibiting the spreading and circulation of wei qi. It means that there is a very pronounced aversion to cold. This is because pathogenic qi is blocking the circulation of wei qi so that it cannot warm the skin. This aversion to cold is different to that which is experienced when there is yang deficiency. When there is yang deficiency, the person is not capable of generating warmth in the body. This means that if a person who is yang deficient wraps themselves up in warm clothes and blankets, they can get warm and maintain their sensation of warmth. When cold has invaded the body, the person is capable of generating warmth. But wei qi is simply not able to circulate the heat out to the skin and the muscles. This means that even if the person wraps themselves up in warm clothes and packs themselves under kilts, they still do not feel warm. The stagnation of cold will also prevent the pores in the skin from opening due to the contracting nature of cold. At the same time, cold will block wei qi, which opens and closes the pores. This means that a defining sign in this pattern is inability to sweat. A priority in the treatment principle is therefore to open to the exterior, which in this context means to induce a sweat, thereby expelling the invasion of exogenous pathogenic qi. The headache, joint pain, and stiffness of the shoulders and the neck is due to pathogenic qi blocking the circulation of qi in the Taiyang channels. The stagnation of qi causes pain and discomfort. Where there is no flow, there is pain. Where there is free flow, there is no pain. The headache will feel tight in character. Wei qi is an aspect of the lung, and it is the lung that spreads wei qi throughout the body. When pathogenic qi blocks wei qi, it will also disrupt the functioning of the lung. This can be observed when there are signs that the lung's descending and spreading function of qi is disturbed, and there is coughing and sneezing. This disruption, the lung's functioning, can also be seen when fluids are not spread as they should be. There will initially be a slight edema of the face, especially a puffiness around the eyes. This is in fact one of the reasons that people can immediately see that someone has a cold or is under the weather. The fluids will accumulate in the lung, or they will rise upwards along with the rebellious lung qi to the nose, resulting in a runny nose with clear watery mucus or with eyes watering. There may be a slight fever that is the result of the struggle between Chang qi and pathogenic qi. The pulse will be superficial. This is because the struggle is taking place in the exterior aspect of the body. The pulse will have a tight quality due to cold blocking the flow of qi. Etiology, exposure to wind and cold. Symptoms and signs, acute headaches that are tight. Headache will be located in the neck and along the urinary bladder channel. Stiffness of the neck, shoulders, and upper back, skin and muscle aches, aching joints, aversion to cold and difficulty keeping warm, aversion to cold, wind, and drafts, lack of sweating. This is a key symptom when differentiating between a deficiency and excess condition. Runny nose and watering eyes, facial edema or puffiness around the eyes, possible low-grade fever, thin, white, and wet tongue coating, superficial and tight pulse. Key symptoms are aversion to cold, headache and stiffness in the shoulder and neck, lack of sweating, aching muscles and joints, superficial and tight pulse. Treatment principle, expel wind cold, activate Wei Qi. Acupuncture points, choose from SI3, bladder 10, bladder 12, bladder 62, LI4, lung 7, DO 14, and GB20. Needle technique, draining, cupping, and moxa are recommended. SI3 and bladder 62 open the Taiyang channel, activate Wei Qi, and expel wind and cold. Bladder 10 and GB20 expel wind and cold. LI4, lung 7, and bladder 12 activate Wei Qi, expel wind and cold, and regulate lung Qi. DO 14 activates Wei Qi. When a person has been invaded by wind cold in the Taiyang channels, they should avoid eating rich food and should preferably only eat soup. They will benefit from drinking hot spicy drinks such as a whiskey toddy, hot ginger tea, or an infusion of garlic, cayenne pepper, and a ginger. They should then wrap themselves up in blankets or kilts to induce sweat. Invasion of wind cold in the Taiyang aspect cold is dominant can be caused by the following pattern. There is no previous pattern. And this can result in the following: Taiyang Fu pattern, Yangming stage pattern, Shaoyang stage pattern, Taiyin stage pattern, and Shaoyin stage pattern. Thank you for your attention.
Let's discuss treatment principles. Case history, part 3. This is a case of a woman aged 38. The clinical manifestation, this woman had suffered from hypochondrial pain on the right side and a feeling of a lump in the right abdominal region for a long time. In addition, she also suffered from a diarrhea if she ate too many cold and raw food. For the last year, she sweated slightly at night. Her urination was frequent and pale. She felt very cold all the time, and the menstrual blood had clots but was not dark. For the pulse, it is deep, weak, and minute. The tongue is pale on the sides, bluish purple on the root and center. The diagnosis is a long-standing liver blood deficiency giving rise to slight yin deficiency, just starting and causing stasis of blood. There is also kidney yang deficiency causing interior cold and stasis of blood in the lower burner. This is a complicated situation. There are two roots, each of them giving rise to two manifestations. The first root is the chronic deficiency of liver blood as manifested in the pale sides of the tongue. This gives rise to a slight deficiency of yin, night sweating, and also to stasis of blood, feeling of lump in the abdomen, clots in the menstrual blood, and purple color of the tongue on the root and center. The second root is kidney yang deficiency, feeling cold, diarrhea from cold and raw food, frequent pale urination, and deep minute pulse, causing interior cold and stasis of blood in the lower burner, tongue, body, purple. In this case, therefore, the stasis of blood can be attributed both to the chronic deficiency of liver blood and to the obstruction from interior cold. For this reason, the tongue is bluish purple. The bluish color indicates cold, while the purple color indicates stasis. As for the relative strength of the upright chi and pathogenic factors, this is an interior condition characterized by extreme weakness of the upright chi, which is a deficiency of liver blood and kidney yang, and by the presence of pathogenic factors, which are the stasis of blood and the interior cold. It is therefore a mixed deficiency excess condition. The deficiency pattern are the liver blood and kidney yang deficiency. The excess factors are the interior cold and the stasis of blood. For the treatment principle, as the symptoms of the manifestation, the blood stasis and cold, are not pronounced, in this case, treatment must be aimed primarily at tonifying the body's chi, hence concentrating on treating the root. However, the manifestation can be treated simultaneously. Treating the root, that is tonifying the upright chi, can be achieved by tonifying liver 8, spleen 6, bladder 18, bladder 17, to tonify the liver blood, and kidney 3, bladder 23 to tonify kidney yang. The clinical manifestation of the manifestation can be treated simultaneously to relieve the symptoms caused by stasis of blood with such points as PC6, spleen 10 to move blood. Thank you for your attention.
Let's discuss heat in the large intestine as we continue with our discussion on the diagnosis according to Zanko organ patterns. Unlike the previous patterns, this will always be a pure excess pattern of imbalance. All the symptoms and signs will be due to the presence of heat, which desiccates and scorches. It has for its etiology, heat can rise in the large intestine due to prolonged intake of substances that have a hot energy, such as lamb, alcohol, chili, and fried food. Exogenous pathogenic qi can penetrate into the yang aspect and generate heat in the large intestine. This pattern has the following symptoms and signs: constipation with dry stool, burning sensation in the rectum, bloated abdomen that resists pressure when palpated. There is thirst. If the condition is due to exogenous pathogenic qi that has sunk into the qi level, there will be profuse sweating. There is fever or aversion to heat, scanty dark urine, a dry mouth, red tongue with yellow, brown, or black coating, and a rapid and full pulse. The key symptoms here are constipation with dry stool, yellow, brown, or black tongue coating. For the treatment principle, we drain heat from the large intestine. In our acupuncture treatment, we can use the following points: LI11, stomach 25, stomach 27, stomach 37, stomach 44, Sanjiao 6, and UB 25. And we can use the draining needling technique. For the explanation on the choice of points, lung 1, stomach 25, stomach 27, stomach 37, stomach 44, and urinary bladder 25 drain heat from the large intestine. If there is heat in the large intestine, the patient should avoid consuming food and beverages that are hot in their energy. Spinach, bean sprouts, bananas, cucumber, fig, rhubarb, and bamboo shoots all drain heat from the large intestine and are therefore beneficial. Spinach is especially salutary because it moistens and lubricates the large intestine. This will enable the stool to move more easily through the large intestine. So this pattern can be caused by stomach heat, invasions of exogenous pathogenic qi, and in turn can result to yin deficiency, yin level heat, and blood stagnation. So to summarize, heat invading the large intestine has its etiology in excessive consumption of heating and or drying foods, externally contracted febrile disease, manifesting as a Yang-Ming pattern, also known as disease of the Qi aspect, possible stomach heat underlying. For its signs and symptoms, there is constipation with dry stools, abdominal pain with dislike of pressure, a burning sensation in the mouth, dry tongue, burning and swelling of the anus, scanty dark urine. The pulse is full and rapid, and the tongue has sticky yellow dry coat. For the treatment principle, we clear heat and free the stool. So for our acupuncture treatment, stomach 25 will regulate the intestine. Li11 clears heat. Stomach 44 harmonizes the intestine and clears heat. Kidney 6 supplements yin and promotes fluids. Bladder 25 moves the large intestine qi. Stomach 37 regulates the intestines and clears heat. And Li2 clears heat, all with needle with drainage. Thank you for your attention.
We now discuss blood deficiency under diagnosis according to 8 principles. When there is too little blood in the body, the tissues will lack nutrition and moisture. This will manifest with dry, pale skin. This will be most evident in the face, which will have a sallow complexion, but there will also be dry skin in general on the body. The hair will also be dry and can shed due to the roots lacking nourishment. Pallor and dryness will be seen on the tongue and lips, and the tongue will also be thin. When the muscles in the limbs lack nourishment, numbness, tingling, and muscle cramps can result. Women who are blood deficient will often have spars or even no menstrual bleeding. Blood deficiency can also be a cause of infertility. Blood nourishes the skin. Blood deficiency will often manifest with dizziness, especially when the person gets up after sitting or lying down. The lack of nourishment to the brain can cause a person's memory to be poor. A blood-deficient pulse is usually choppy or fine. There are further symptoms and signs that are specific to heart blood deficiency and liver blood deficiency, respectively. In practice, both of these organs are almost always affected in a blood deficiency condition. This means that there will nearly always be symptoms and signs of these imbalances when there is a general blood deficiency. Liver blood nourishes the eyes. Liver blood deficiency, therefore, typically manifests with spots in the visual field, blurred vision, and poor night vision. Liver blood also nourishes tendons and nails. Brittle, weak nails that fray or nails that are dry and ridged are therefore always a sign of liver blood deficiency. There will often be poor sleep because the hun is not being anchored by liver blood. When the hun is not anchored, there can be dream-disturbed sleep. In extreme cases, the person can have the feeling that they leave their body at night. The close relationship between the hun and liver can also be observed in someone with liver blood deficiency who has become depressed and has no vision in life because the hun is not being nourished. Heart blood deficiency can be seen in symptoms such as palpitations. This is because the muscles of the heart lack sufficient nourishment to be able to carry out their functioning optimally. At the same time, the Shen lacks nourishment and is not strong enough to control the physical aspects of the heart. The emperor is losing control of the kingdom. When the Shen is not anchored and nourished by heart blood, there will be symptoms such as insomnia and a slight feeling of unease or anxiety. Blood deficiency can arise when not enough blood is being produced. This will be due to the person not consuming enough food that nourishes blood or the organs that produce blood being Qi deficient. Blood deficiency can also arise when the body loses blood through hemorrhaging. This is typically seen after childbirth, surgery, physical trauma, and heavy menstrual bleeding. Furthermore, prolonged physical or mental emotional stress consumes and thereby weakens blood. Symptoms and signs are dizziness, palpitations, pale and sallow complexion, dry skin, dry and pale lips, insomnia, frayed, brittle, or rigid fingernails, scanty or absent menstrual bleeding, infertility, numbness and tingling, muscle cramps, poor memory, spots in the visual field, blurry vision, depression, mild anxiety or unease, pale, thin, and dry tongue, choppy or fine pulse. Key symptoms: pale and sallow complexion, dry skin, scanty menstruation, choppy or fine pulse. Treatment principle: nourish blood. Choose from bladder 17, bladder 20, bladder 21, bladder 23, spleen 3, spleen 6, stomach 36, kidney 3, RAN 4, RAN 6, and RAN 12. If there is liver blood deficiency, add liver 3, liver 8, and bladder 18. If there is heart blood deficiency, add heart 7 and bladder 15. Needling technique is tonifying. Moxa recommended especially on stomach 36, spleen 6, and bladder 17. Bladder 17 nourishes blood. Bladder 20, bladder 21, spleen 3, spleen 6, stomach 36, and REN 12 tonify spleen chi, which is needed to produce ku chi. Bladder 23, REN 4, REN 6, and kidney 3 nourish jing and tonify yuan chi. Liver 3, liver 8, and bladder 18 nourish liver blood. Heart 7 and bladder 15 nourish heart blood. It is important that a person who is blood deficient eats a diet that is rich in food that nourishes blood. It will be good for them to eat foods that are rich in blood, such as red meat, bone marrow, and blood sausages. Eating organic liver will be particularly good. Green leafy vegetables will also be beneficial due to their high iron content. Other foods that nourish blood are beetroot, eggs, seaweed, watercress, avocado, dates, and beans, particularly achuki beans, black beans, and kidney beans. A person who is blood deficient should avoid sugar. Stimulants such as coffee and too much alcohol. Nettle tea will be good for them. As well as being rich in blood-nourishing foods, their diet should strengthen their spleen chi, as the spleen must transform the ingested food into ku chi, the raw material of blood. This means they should consume warm, prepared food that is not cold in its energy and that does not create dampness. Thank you for your attention.
Let's discuss depression, heart and spleen deficiency. The clinical manifestation, there is a depression, brooding, always thinking, there's palpitation, timidity, difficulty in falling asleep, pale face, dizziness, poor appetite. The tongue is pale and the pulse is weak or choppy. The pathology and mental emotional pattern, the heart blood is the residence of the mind. And when it is deficient, the mind is deprived of its residence, resulting in depression, anxiety, and insomnia. This pattern is characterized by qi and blood deficiency, the latter affecting 3 organs, that is the heart, spleen, and liver. Heart blood houses the mind, and its deficiency causes depression, anxiety, and insomnia. Liver blood houses the ethereal soul, and its deficiency causes insomnia and dream-disturbed sleep. The patient's profile, the pattern of heart and spleen deficiency is more common in young women. It is usually caused by sadness and grief. The treatment principle is to tonify spleen chi, nourish heart blood, and calm the mind. For the points of the heart and spleen deficiency, we use stomach 36, spleen 6, bladder 20, bladder 21, REN 15, pericardium 6, bladder 15, heart 7, do 14, do 20. All points with reinforcing method. Stomach 36, spleen 6, bladder 20, and bladder 21 tonify the stomach and spleen and chi and blood in general. REN 15, pericardium 6, bladder 15, and heart 7 nourishes heart blood, calms the mind, and lift mood. Do 14 nourishes heart young with direct moxapones, and do 20 lifts mood. Thank you for your attention.